Today we want to talk about beyond state-of-the-art fibromyalgia diagnosis and treatment. We had long ago identified fibromyalgia and pre-fibromyalgia. Pre-fibromyalgia shows some of the protein deficiency is always there. Some infections may be there, and they may have achieved chronic disease like chronic fatigue and irritable bowel, or any one of the number of symptoms. But they don't have our established criteria of degenerative disc disease, along with the protein and sulfur deficiency and the other multiple deficiencies. And they may not have all the viruses. They may just have one virus or whatever. The other criteria for fibromyalgia is lymphadenitis, which is basically infection of the lymphatic system, where the pathogenic agents have penetrated into the lymphatic system, lymph nodes, and explains, because of its neurological connections, which are different than the spinal segmented connections, some of the rolling pains that are found in fibromyalgia. So, and these remain mysteries to modern medicine, because they don't really have good, easy ways to tell this. When we diagnose it, we're doing an energetic match, which takes basically seconds. This has been sort of poo-pooed by doctors who have come in contact with it, but these doctors that work on the front lines of medicine don't seem to know anything about latent infections. Latent infections are an interesting source of study, because MRSA staph has been proven to be rampant in the population, but it is not readily diagnosed in the people that are flocking, even locally here, to the clinics to have their skin lesions diagnosed, etc. And we just had a case where they mistakenly diagnosed it as herpes or chickenpox. And they don't seem to be able to tell the difference between herpes and chickenpox. So we have an area where people have latent infections that are just waiting to be awakened, and while they're waiting to be awakened, they're still producing symptoms which are not understood by the medical profession, basically, because they cannot culture it. It does not show in the blood. It is in the tissues, and unless they do biopsies and a whole bunch of things which are not justified as standard procedure, they are forever locked out of. But this explains why people who go in for an operation have about a 50% chance of being infected, no matter how clean and sterile the procedures are, because the organism is already locked in their body. And the basic reason for that is protein deficiency. If a person took nothing but our Platinum Plus, he would be 50% protected against half the diseases of the world. If he took 50%, if he took our Platinum Plus and our maintenance package, he might be protected against every disease in the world. Or if he found it, if it attacked him, he would shove it off, as we have been able to do last years with viruses and etc. So we have now 3 different categories. We have pre-fibromyalgia, we have fibromyalgia with very established guidelines and diagnosis for that, and now we have another condition which we call complicated fibromyalgia. Now these people, some of the people have not responded to our regular fibromyalgia protocol, even though the majority do very well and just march on out of the problem. These people are loaded with hidden, what we call stealth bacteria. The literature is now calling them small colony variants, because they do sort of change their characteristic when they're hiding in the tissues. And they do not interact with, apparently, the lymphatic system or the blood system to raise the white cell count and change the nature of the white cell count. Among these small colony variants, which we call latent infections, or they call latent infections, we look at them as real problems to be dealt with. We have recently found drug-resistant tuberculosis, which is a nightmare, regular tuberculosis, which was a nightmare anyway, MRSA staph, which is a drug-resistant strain, except for a few, but the doctor has to know enough to go and give it, and that's the rub where people are not treated properly when they have these hidden infections. Then we have, besides that, we have the regular staph, and recently we looked at some people who were very, very badly off, where they had infections all over their body, and they had a Bacillus proteus. Bacillus proteus can be a nightmare also. So what we're seeing very clearly, and what we have been able to deal with effectively through nutrition, is reversal of the MRSA staph in these complicated cases. And then the people who called us and say to us, I didn't get any better, they are now getting better, because we found that where these bacteria hide, the fibrin is deposited, the protein APL builds up, it's protected by a fibrin network, the metals are locked in there, and where the average fibromyalgia patient merrily gets rid of his metals, these are locked into joints and organs and things like that. So it's a whole nother world which can be disheartening. But as we learn about it, we are also finding natural ways to battle these things. So we would like you to tune back in and find out how we sorted out some of these things. MRSA staph, we now have a protocol, Vickery MRSA staph protocol, which has worked and cleaned out even root canal teeth. Previously, the advice was to pull the root canal tooth, because dentists didn't even know that it was there, even if they put it there. Today, we've seen, and this is an interesting thing, the body seems to clear it, just as the old-timers said, from above downward. And we've seen teeth that I would recommend ordinarily to be pulled clear up from the MRSA staph. And it descends down into the body, it descends down into the bladder. It's where it was there. It was there before, but it stays there. It goes down into the lower extremities. It stays in the ileocecal valve, and usually at least the lower spine, which accounts for all the leg problems, breakouts, and things like that we have. So we've learned so much in so little time. I don't ordinarily talk about these things, but it's so urgent because so much harm is being done with maltreatment of these people that I think you should know that. And it's basically goes from pre-fibromyalgia, fibromyalgia, and complicated fibromyalgia. And so far we have workable alternatives for all of these conditions. Thank you.